Hello, my name is Kylie Goeres, and I did my honors presentation on anticipatory grief in students of military versus civilian families. I did this because my dad is in the military, so I thought, might as well do something about that. So I'll talk about what anticipatory grief actually is. I feel like that's the most important thing that a lot of people also don't really know. It's basically mourning the loss of a person before it actually happens. So a lot of the times the term is used basically in people with like terminal illness, in cases of dementia or Alzheimer's, when you start to have a loved one who's beginning to pass or with some sort of cancer or something and you're mourning that loss before it happens. But in the context of the military, this can also be in terms of deployments. So you have a family member going into war or going off somewhere that they might not return from, so you get that kind of anticipation of grief, hence anticipatory grief. Get it? Yes, next slide. The reason why I did this is because, especially with the student population, which is what I mainly looked at, is because adolescents in general have a very hard time with grief and processing grief and that kind of trauma. Especially in military families, they kind of report higher levels of a social disconnect and isolation in that kind of sense. And then to bridge the gap between kind of the research or lack of research that I saw, I wanted to combine anticipatory grief in military families and populations with civilians or those just dealing with, grief in cases of terminal illness or some sort of ongoing prolonged illness. So my research question was how this grief differs in the two populations. Next slide. And then I did a lot of literature review for this. That was kind of like the main thing I did before actually like sending out a survey or anything. So I just wanted to also clarify the differences between grief, complicated grief, anticipatory grief, and the cycle of loss. So complicated grief is a DSM-5 classification, so you can get diagnosed with this if you have a prolonged period of grief or these symptoms of grief after like 2 months of a passing of a loved one. Then you will get this diagnostic information and you will have medication and such. But anticipatory grief is not in the DSM-5 because it is before something actually happens and it has no time frame to be considered for any diagnostic measures. So the way the cycle of loss works specifically is within military populations and military students. So what I talked about a little bit earlier with deployment, that is referred to in a lot of literature as the cycle of loss, because someone goes off, you get deployed, you come back, you have a little reunion, they leave again, maybe you guys move somewhere, it keeps going on, creating a cycle of loss. So you keep getting these like patterns and symptoms of grief and eliciting these kind of same emotions as like a complicated grief diagnosis or just a normal grief diagnosis. This is a scale, and the scale that I use to measure grief. So the anticipatory grief scale is called the AGS, and it is originally 45 questions long, but I chose to use the AGS 13 in my surveys and the survey that I sent out to study it, not only because I think it's more efficient, but also because I only sent out this survey to students at St. Edward's. No one is taking a survey with 45 questions, so. But it uses a Likert scale, which is 1 to 5, 1 being strongly disagree, 5 being strongly agree, which is important when I talk about statistical analysis later. But the first 7 questions of the AGS 13 are behavioral components in questioning, and then the next 6 are emotional. So this is a AGS scale for dementia specifically. Obviously, I'm not studying dementia, so I made the terminology more broad. So, like, I daydream about how life was with my relative before the diagnosis of dementia. I would say I daydream about life with my relative before a prolonged absence or before a terminal illness. I just made the wording very vague so that military-connected students and civilian students dealing with this could both kind of answer and fill in their own blanks. And another reason why I wanted to look at students in particular is because they have a lot of higher risk factors as adolescents, especially with shifts in identity as we're going through college and what we're doing. It's also, a lot harder for adolescents to deal with the loss, especially when you're in college, probably by yourself, away from your parents, away from your loved ones. That specifically leads with like symptoms of grief, and especially for emotional and like risk factors of stress, just like grieving in general. We can go to the next slide. So for the data that I collected, I used that survey that I showed earlier, and I got around 25 responses from my samples, and I did a t-test, and I got means, averages, and standard deviations. I also included informed consent, thank you IRB, and I did demographic information, making sure that people were in college because I wanted to look at students. Also making sure that I excluded veterans because I want to look at students with a military connection, not students who are in the military. That doesn't jive with what I wanted to do. So that is how I tabulated my results in that kind of sense. So just kind of like an overall review of my results is that there is not a statistical significance. This, however, doesn't mean that there's no significance. It's just kind of like when you do analysis, a p-value is kind of what determines statistical significance. So if something is 0.05, that means it is statistically significant, and mine was 0.1. But if you look at means, you can kind of see that on average, 3.8 for military responses means that they're kind of averaging responding to all the questions with slightly agree rather than just being neutral on topics. So military students did have a little bit of a higher reaction to a lot of questions than their civilian counterparts, but overall not statistically significant. And then what I talked about earlier, there is 7 behavioral questions, 6 emotional questions. So I kind of looked at those separately and then did the same thing, t-test, p-values, means, standard deviations, all that fun stuff. And I kind of found that emotional scores are a lot more similar, whereas behavioral scores have a bigger difference, which is one of the main things that I really was interested in and wanted to focus on, which is in my next graph, So this is kind of like my biggest takeaway, my biggest significance that I found within actual data and coding in R to find all of this, because I had a p-value of 0.08, which is approaching significance. So it's kind of the most important thing that we have, or that I have. Again, also with the means, showing that military students reported higher averages of negative behavioral reactions to the questions rather than the emotional ones. Yes, next slide. Basically, to interpret that, it kind of just means that the behavioral questions were more profound for students in military populations than their civilian counterparts, meaning that there's more research to be looked into for behavioral kind of outbursts and how that reaction goes versus emotional, which is more kind of average between civilian and military populations. So statistically, there is no actual statistical significance for anything. The biggest trend that I found was in behavioral components of the survey, where military students showed higher, consistently higher scores in that, but also overall they showed an average of some higher scores for everything, for every section of the survey and for each answer that they did. Findings suggest a different type of intensity rather than focusing on emotions. A lot of this is based in behavior for military students, as well as anticipatory grief is a shared experience for all populations. So I'm not really exactly looking for civilian students to not experience grief at all. I just wanted to see if there's any difference within those two experiences. Yes, this supports a continuing model for anticipatory grief as military students experience greater functional disruption in their behavior in their daily life and how they act out. What I really want to do, and what I had a big limitation on, was my sample size. I think 25 is pretty small, but this is a small school, so that's fine. But another thing is that I didn't have an equal counterpart to military to civilian. I had 15 civilian students take it and then 10 military students, so it kind of also isn't even at that point. Another limitation that I had is I think because there's one extra question in behavioral components in the scale, that could have also been what led it to be more significant for my data. But to continue research on this, I would have liked to do a longitudinal study, maybe ask some qualitative questions like, what kind of grief are you dealing with? What loss are you experiencing? Things like that. But overall, I think it's just important to recognize that grief happens to everyone and it is anticipatory in all populations and people. So, yeah, that is all.
So obviously, like you said, your sample size is very limited, and that's a crazy amount of reach onto your actual statistical analysis. So like you said, there's implications for future research. I do think you did a very good job showing that there is a trend between what you were looking to prove between the military and the regular community. So for future research, do you believe that there would be statistical significance to be proven should you have something that's a sample size large enough and possibly also not geographically skewed like we could be here living in also on a private university?
Yeah, I mean, I think overall there's kind of a trend in that like difference with military students. I also think because we're here and like I don't have like an access like a pool of people that are in the military, it's kind of different. I think if it was larger and more like spread out across the country, or like growing up in like DoDEA schools or like schools overseas, that's also like a huge like sample size that I didn't really tap into. So I think a lot of my data could have been a lot better if I had more people and people from more diverse locations and stuff. But I would hope that the data would be more significant if that was the case.
Are there restrictions on where you can send your survey?
I had to do IRB for that, so I just wanted to make it as simple as possible to just do it on campus and make sure that I could get that done in time. So, yes.
With your background with being part of a military family, do you feel like you have like a certain bias towards this study, or like towards anticipatory grief in the military affiliated population, or do you feel like that benefited the study because you have perspective in it?
I feel like I don't have any bias in this because my dad was never deployed, so I don't really have that cycle of loss that everyone else does. I just kind of thought of it because of like my ties like to like being in the military and seeing like my friends with that and how they acted, which is not really a benefit. That's just kind of how I thought of the question. So, yeah. Yes.
Amazing work in such a short amount of time. I believe the 25 is a very large number based on how fast you're doesn't get approval. And for IRB, you know, how at university, if you wanted to reach out to other universities or bases, you would get approval from their IRB. So that's a longer process. So my question for you is, for the AGS, since it kind of leaned more toward the dementia side, I believe there's very limited types of questionnaires specifically for military families. So I think that's something that should be developed, or that you maybe should develop one day for these types of anticipatory grief assessments for the specific population.
Yeah, I mean, I think it would be beneficial just to kind of have more specific testing and like assessments for all kinds of grief, like because the main like accessible one is dementia, like that's like the biggest thing, or cancer. So I think there's a lot of like lack of specifics that kind of makes it harder for people to like take these like tests and get like a diagnosis or like help with anything. So I think it would be beneficial to have that just like with more specifying information in, you know, assessments. But maybe I would be interested in doing that, maybe not, I don't know. We'll see.
So my question is kind of related. So are you planning to pursue studies in psychology? Studies in psychology?
Yes, I'm doing a PhD in clinical psychology after I graduate. So I'll be doing,
Okay.
Oh,
Oh, like that, okay.
yeah. Yes. Okay.
Okay. Carlos? Kylie's mentor will still up our minute. You're welcome to say a few words if you want.
So, Kylie, what you have done is a demonstration of people who you genuinely care about and who have been in your life. And we've talked about changing the world. I know a certain university says that, so we won't deal with copyright infringement. But what I really like to say, especially the classes you took with me in the past, is to work on changing, don't forget to work on changing people's world. And I think the field that you're heading to is certainly going to do that. Couldn't be more proud of you, and I'm very, very excited for your future endeavors. And Palo Alto is remarkably lucky to have you. Yep, absolutely. So with this, Alrighty. Congratulations again. Yeah, so proud of you. Yeah.